Are your kids feeling down, discouraged, or perhaps depressed? California Health Care Foundation has found that more teens are using social media to manage their mental health. Joining us live in our Parenting Alert, we have President and VP and co-founders of Family Iniaitive, David Brown and Angeli Van Dree, getting us more on ways you can help your kids cope. Good morning, guys. How are you?
Doing fantastic. Good morning, everybody.
Good morning.
Well, question for Angeli then. So can you tell me a little bit about the increase in depression that's being reported for young people right now?
Absolutely. Thank you so much. So this study was done in just this past fall, so basically from September to November of this past year, and looked at teens basically between the ages of 14 and young adults up to age 22. And what they found was the rates have almost doubled for some of those kids. For that younger age group from 14 to 17 years old, the rate has doubled from 13 to 25%. And for the older cohort, so 15 through or 18 through 22-year-olds, it went up about 12%. What's really interesting is that individuals, so young people who were either diagnosed or had family members who were diagnosed, were significantly more likely to report the symptoms of depression. And really it was about the stressors they were feeling, whether it was more responsibilities they were taking on for their family, taking care of other family members, if they were worried about their own personal loss of income or loss of income for the family. Really about connecting those same things that we've all kind of been experiencing over the last year. Our young people are feeling those same things as well.
That makes perfect sense. And I guess going off of those stressors that you were just talking about, David, a question for you. How is social media now playing a role in how these young people are dealing with stressors or feeling depressed?
Look, as a dad and as a clinician, I'm certainly worried about screen time, about internet use and content that's on the web. But the really interesting thing to me about this study is that we see almost 85% of this group of teens and young people were using the web and using social media to actually gain access to really good information. The key searches we're looking for there was mental health, anxiety, depression, exercise, meditation, information about COVID-19. So it's really good to see clearly, social media can cut both ways, but we're seeing young people really leveraging these resources to gain access to information, which is fantastic, but also looking for solutions. And again, I think seeing all that is an encouraging sign for parents and for folks that really care about young people.
Again, makes perfect sense. So question then, I guess for you both or for either one of you to answer, when should a parent be concerned? And if so, what should they do?
Yeah, let's say a couple of things that folks should really be paying attention to, particularly now. Changes in behavior, right? So if we're seeing changes in, ways that they're engaging with you, anything related to their communication strategies with their siblings, with each other, anything like that that jumps out at you as a caregiver that you're seeing a shift in them, that to us would be a big red flag.
Definitely. So also changes in their hygiene, their sleep patterns, their eating patterns, things like that are definitely red flags for something has changed for that child or a young person, or something's going on with them. But I think our solution is to connect with those kids, and for your children to talk to them. Don't be afraid to reach out to them. I think one of the things we really liked about this study is what we found were, how Dave said, 85% of those surveyed were turning to social media for help. They were looking to normalize their experience, to find other people who are feeling those same feelings and saying, hey, this is all right. Like, we're all kind of going through this. So if we can do that in our own homes, that's a great step forward to help our families and help our kids.
Yeah, absolutely.
That's great. Angeli and David, thank you so much for joining us this morning. We really appreciate it. Are your kids feeling down, discouraged, or perhaps depressed? California Health Care Foundation has found that more teens are using social media to manage their mental health. Joining us live in our Parenting Alert, we have President, VP, and co-founders of Family Iniaitive, David Brown and Angeli Van Dree, getting us more on ways you can help your kids cope. Good morning, guys. How are you?
Doing fantastic. Good morning, everybody.
Good morning. Happy Saturday.
Awesome to have you both with us this morning. So let's start with Angeli right now. Can you talk to us a little bit more about the increase in depression being reported among young people?
Yes, thank you so much for the opportunity. So this study was actually just done recently, this past fall. And what it found was the rates of reported symptoms of depression almost doubled for some of our youth. So for those kids aged 14 to 17, the rates really went up from 13% to about 25%. And even in the older cohort, so the 18 to 22-year-olds, it went up from 34 to 48%. So we're really seeing an increase. And what's interesting, what they found was either these youth who were diagnosed or had family members who were diagnosed with COVID-19 were more likely to report the depressed symptoms. And I think part of this is related to the additional stress, not just us as adults are feeling, but our teens and young adults are also feeling related to additional family responsibilities, job loss, financial stressors, being able to connect in a safe way with their friends and family. So a lot of those same things that we have experienced, I think our young people are also experiencing those and are impacting their mental health.
For sure. And so I guess, David, maybe a question for you, as we were just mentioning stressors. You know, how does social media play a role in all of this when kids or young people are dealing with their stressors or maybe feeling depressed?
Mm-hmm. So this research is really insightful. And so to me as a dad, as a clinician, you know, I think a lot of parents are really worried about screen time, obviously content on the web for teens and for young adults. The thing to us that really jumped out to us that I love is that young people are savvy, obviously, with using the web. And so what we see here is that a lot of searches related to mindfulness, meditation, fitness, trying to get facts about COVID-19 and information about mental health support. So it's wonderful to see really that young people are savvy. They're using technology really to help meet their own needs and to gain facts, which is a phenomenal thing. Obviously, the other thing throughout this whole last year is it's been really isolating and challenging on the socialization aspect for young people who love to socialize. And so what we see through technology is it's really allowed them to remain connected to their peer group. And in doing that has helped support their mental health. And also by connecting with their peers, they see other folks are struggling too. So again, I think it gives them some level of encouragement that they're not alone in this situation.
And the last question for you both, you know, when should parents be worried? And if they are, what should they do?
So some red flags for us, and we talk with caregivers a lot about this. So changes in behavior, right? So changes in energy level, you know, changes in hygiene, changes in dress, anything is, you know, mom and dad, anything that jumps out at you about you're seeing something different in the young people in your home, that would be something we would definitely recommend folks pay attention to and stay keyed into.
And what we would recommend is to connect with your child. So like David said earlier, you know, our teens and young adults are finding that connection with peers that's helping normalize some of those feelings. So I think sometimes as adults, we're afraid to talk to our kids about those things because we're worried we'll bring more stress and anxiety to them. But what we have found through this study is kids are actually looking for that. Our young adults and teens are looking for some way to normalize and connect. So to ask and say we're feeling these things too, and help them if they don't feel comfortable talking with you as a parent, to find another trusting adult to help link them with some of these groups or apps that can help them process some of what they're experiencing right now.
Awesome. Angeli and David, thank you both so much for joining us this morning. Great advice as well.